Hello, everyone. My name is Manuel Encarnacion Ramirez, second year resident of the Ruden University in Moscow. What I'm going to present today is the functional result after 6 months of patient surgical cranioencephalic trauma operated. Well, there is no conflict of interest to the author of any conflict of interest on this abstract. So, adjuvant therapy in current neurosurgery have turned management some patterns of different pathologies, allowing the patient more and more better functional result after surgery. Developing techniques such radiosurgery, robotic surgery, or dendritic cells vaccine have developed better results for our patient. Despite this, the skull spinal trauma skills are 100% depend of the surgeon skills. The main objective of this project is to determine the functional status of surgical operated patient after 6 months of trauma. Establishes the association of functional status to the predictive variable of the impact study. Also determine the relative risk of worse functional prognosis based on associated predictive variables. The design methodology was a retrospective and longitudinal study. Our cohort was 22 patients. The place was Dr. Ney Arias Hospital in Santo Domingo, Dominican Republic. The material and method was the inclusion criteria. Was the patient major than 14 years old? The patient with the trauma cranioencephalic, taking control surgical. The exclusion criteria was patient with incomplete medical record, patient with multiple surgical trauma injuries, and patient cannot be localized. The material method, we used the impact and the Glasgow outcome scale extended. The database we used was the EBM SPSS, the version 15. Now is the version 20. The analysis was presented analysis of the absolute frequency, state risk, and we used the Fisher risk, the Fisher test. The statistical significance, we use the P to recognize it, the letter P. So the impact formulary, we use the age of the patient, the motor response, also the hypoxia, the low blood pressure, Marshall classification, hemorrhage subarachnoidea, the epidural hematoma, glycemia level, and hemoglobin level. Also, we use the Glasgow outcome modified, the standard, and the type of injuries. Our results. Minor than 30 years, we have 40 patients. From 30 to 39 years, we have 2 patients. For 40 to 49, we have 1 patient. 50 to 59, we have 1 patient. Major than 70, we have 2 patients. In our results, we have the type of the lesion. We have hematoma, epidural hematoma, 2, subdural hematoma, 3. Other lesion, we have 2. So about the Glasgow outcome response, we have minor than 8, we have 4. Glasgow minor than 5, we have 3. And from 14 to 15, we have 3. About the functional scale of Glasgow outcome extended, we have no relation between the pupillar reactivity, and the age. The variable we use and have better outcome was the motor response. In the place of the disease of the death of some patient, we have 1 out extrahospitalizary and 3 intrahospitalizary. Alive, we have 70 patients. The pupillar reactivity, we have 8 patients with the pupillar reactivity have a very good result after go out of the hospital. About the functional results, we classify or we define the functional results about the possibility of the patient to do all the normal work, the normal function he make by himself, no using help and other people. So we can see the Glasgow Scale standard. We have a patient who died. We have 4 patients who died. And the relationship between this patient and the hypoxia was very high. But the patient we have a better result don't have relation between the level of hypoxia and the pupillar reactivity. The outcome we saw in our patient have better result was the functional response. In the functional response, we say the patient have a normal flexion and don't have pathology, extension or flexion. We use here the impact scale, and we can see the unfavorable outcome and mortality in some patients. In conclusion, 67% of our patients had a good functional result, moderate disability, and good recovery. The mortality was 23%. So only the answer response was the variable to predict the significance and functional response in our patient. No other variables. Thank you so much. Remember to all our patients use the Hamlet.